Hello, my name is Aubrey Shackelford, and I'm an engineer, entrepreneur, and most importantly, father. One of my children had Kawasaki's disease that was not diagnosed in time, missing an opportunity to reduce the chances of the complications she now lives with. Because of this, I want to do my part to help raise awareness for the Kawasaki's disease and try to give parents a chance that we didn't get. Kawasaki disease is an inflammatory response to some unknown agent that primarily affects the cardiovascular system. Scientists don't know the cause, but there are some interesting hypotheses being explored to find out. What we do know is that it primarily affects infants and children under 5, although there are cases reported affecting adolescents and teenagers, and that there are some common symptoms that can help doctors and parents alike to recognize it. Early symptoms of Kawasaki disease include a fever that lasts for 5 or more days, rash, often worse in the groin area, red, bloodshot eyes without drainage or crusting, bright red, swollen, cracked lips, and a strawberry tongue, so called because it appears with shiny bright red spots after the top coating comes off the tongue, swollen hands and feet with red palms and soles, and swollen lymph nodes in the neck. Unfortunately, some kids do not show all of these symptoms, nor do they all show at the same time. As a result, if the child has had a fever together with 2 or more of the symptoms, a parent should be concerned about Kawasaki disease. Some of these symptoms can look like other diseases. For example, the rash and bloodshot eyes can be misdiagnosed as strep, which is what happened to us initially. There's no specific diagnostic test at this time, although there is work being done. So as parents, we need to ensure our pediatricians are exploring Kawasaki's disease as a potential diagnosis when there's an extended fever and 2 or more of the symptoms identified. This is critical because the disease can cause death or leave behind long-lasting problems. The most common long-term complication are aneurysms, or ballooning out of the arteries that feed the heart with oxygenated blood. This complication makes Kawasaki's disease the #1 cause of acquired heart disease in children in the U.S. With early diagnosis and treatment, the odds of having these complications can be reduced, making general awareness important in the fight against Kawasaki disease. So remember, if your child has a fever lasting 5 or more days, together with 2 or more of these symptoms, bloodshot eyes, rash, strawberry tongue and red cracked lips, red or swollen hands and feet, or swollen lymph nodes in the neck, please ask your doctor whether your child could have Kawasaki's disease. Finally, a special shout out to Greg Chen and the Kawasaki's Disease Foundation for helping raise awareness, providing community support, and facilitating research. Note you can find all of this information and more on their website, kdfoundation.org.